This is a question I receive all the time. If I have a loved one who is in a manic episode and has no insight into the fact that they are currently sick and in an episode and is engaging in destructive behavior and jeopardizing his own life and the lives of others, how can I get this person help?
And I think that is one of the hardest scenarios for a loved one to be in. In cases like this, I think it is important to get people immediate help. You can certainly call 911. You can certainly take somebody to the emergency room, make sure they get, an urgent psychiatric evaluation. And this can be very painful for many loved ones because, certainly if, the patient objects, if they don't feel the same way, it can be very, very delicate.
It's a very difficult situation because oftentimes the family and friends, they feel helpless. And unfortunately, there's a lot of times where there's no helping this person. They are so convinced, they're so out of touch with reality. They can't accept when you show them evidence of the problem and the damage they're causing. Unfortunately, a lot of times you just have to wait for the mania to get extinguished and the damage has already been done. But like Pat was saying, even if you have to involve emergency services, because this is an emergency, people can engage impulsively, they can have a big increase in their tolerance for risk, and they can, their life or livelihood can be in jeopardy. Certainly. But it is amazing how effective medications can be in treating acute mania. There is absolutely hope that if you involve emergency services, which can be very difficult, of course, that once medicated, even in a few days, let's get him sleeping, let's get a mood stabilizer in him, let's titrate it up quickly, let's get him into some sort of safe environment where he can't jeopardize his or other people's lives or her, that there is absolutely hope that this can be managed and treated in the acute setting. But the barrier there is getting the person to accept treatment. And if you have to involve emergency services and perhaps treat them against their will, despite the acute pain and you feeling like you might be betraying your loved one, that can literally be a life-saving approach.